Sorry for inconvenience. Now we will enjoy beyond the limits of Ophidia. So first of all, I need to tribute a great person, Dr. Samuel Christian Friedrich Hahnemann, who was the basically German. And you know very well, sir always says, German are perfectionists, not like our Indian. આપણે જો પેલા ઓડિયો का टाइम था अभी तो 3 વાગી ગયા ચાલે આપણે અડધો કલાક ચાલે Germans are not like that. They want exact perfectionist sharp like a citron sharp. So I would like to tribute a great man who was known for the dare to be wise. Then a line of homeopathy, Dr. Praful Vijayakar. This is in fond of remembrance. Today we have started the Materia Medica series and we have started the Ophidia in our clinical practice. And the topic is a beyond limits because he was a man of the beyond limits and limitless scope. Then I will take the blessing of my Guru Dr. Jitesh Patel from Vadodara, where I have started my clinical practice initial days after passing of the college from Dr. Jitesh Patel. And he was always says, Jai Hahnemann, Jai Homeopathy. He has spent all life and he had give the all time for only homeopathy. If someone check the sample of Dr. Jitesh Patel, he will find the homeopathy in the blood. Now we have Ophidia. These are the common Ophidias. What generally we are practicing, Lachesis, Crotalus aureus, Cascavella, Naza, Elaps, Viper, Shankis, Bothrops, and toxic office and black mamba. Generally we not use, but I have used in my clinical practice. Ophidia means the snake. If you want to understand, thus it is prepared from, and it is a poison of the snake, venom of the snake that is prepared from. Now we want to understand what are the venoms content, which enzyme content, and what the systematic effect in the body, so we can understand very well the differentiation of the Ophidia in our clinical practice where patient come with that particular disease or pathology. So these are the hemotoxic, neurotoxic, vasculotoxic, lymphotoxic, cardiotoxic, almost all over the system which is affected by the poison after this bite. So we have different Ophidia and we will see how one Ophidia is different from the another Ophidia in our clinical practice. So neurotoxic, vasculotoxic like Lachesis, Viper, cardiotoxic, Viper, Bothrops, Lachesis, Naza, hemotoxic, Lachesis, Viper, Crotalus aureus, glandular toxic, Crotalus cascavella, Naza, and Vipera. This is one of the interesting things. The initial, when Herring was proved himself with the Lachesis muta, first symptoms was developed by he was uncomfortable around the neck. He has to loosen the clothes. So this is the typical of the Ophidia, where sensitive of the neck, external as well as the internal, and any pathology around the neck is Ophidia. Next. These are the clinical entry points of the Ophidia. First of all, I would say Dr. Vijayakar was first understand that this is Ophidia. Then he was differentiate how this Ophidia is different from other Ophidia. What is the unique characteristic of particular this person, this Ophidia? And one thing, I am really thankful to Dr. Vijayakar, because when I was suffering from COVID in July July, and I called to sir. After 1 hour session, sir said, take the Lakesis 50 m, you will be all right. I started the Lakesis 50 m. I started Lakesis 50 m. I have taken the 70 dose of the Lakesis 50 m, and today I am in front of you. And thanks to Lakesis 50 m, and thanks Dr. Vijayakar sir, who had given me. I was thinking about lycopodium. Sir said, no, it's only Ophidia. Snake has a capacity to coagulopathy. My D-dimer and ferritin was rise, and 60% lung involvement was there. And literally, I was 1 month in a room with silent. Okay, now entry points of the Ophidia, secondary extroverted. Whenever the Ophidia comes in our clinic, before coming to clinic, he has known about everything, information about us. I can say Ophidia are the Mr. Google. He will not only search on Google, but he search on the surrounding society. Who is Dr. Jitesh Chosaliya? How is his practice? What kind of the practice? He knows about everything about me before coming to me. And then he will come, and as same, this is a secondary, same, he will not start conversation. He will first sense to you and then the approach. He will listen, he will silent, and then watchfulness. He is a very watchful. First, every vicinity of the surrounding, where the what happening, then he will come into the field. This is the Ophidia. So they will start conversation. Once start conversation, chance is no more. This is the locality of the Ophidia. This is a secondary extroverted. Another thing, they are very sharp, quick, witty. This is a disposition. This is a genetic characteristic of the Ophidia. Quick brain, sharp, witty, intelligent, sharp sense of the humor, like Kapil Sharma. When you talk, the fast processor is, Dr. Vijayakar was always saying, they have fast processor. GB, TB, RAM, both भारी RAM होती है. They have storage as well as communication, as well as the perception, as well as the interaction. These are the genetic quality of the Ophidia. Quick brain, sharp, witty, intelligent, sharp sense of humor, and sharp humor of the mind. Quick to act, and they are precocious. Precocious, they can understand more than the age. Nowadays, lots of the child are precocious. They can understand the age. Parent says, my child is very intelligent. He can understand what the 40 years man can understand. Okay, they are happy. But all the precocious child will suffer from the syphilitic disease very soon. And they will suffer from the autoimmune disease also. This is a syphilis of the Ophidia. Loquacious out of the danger and threat of life. And loquacity is always changing the topic, not stick to the one thing, another, lots of the changing subject one from the another. And this is very important. This is a general entry point of the Ophidia. Another thing, in front of the clinic, when Ophidia comes, he will comes, and once you observe the Ophidia, there is very sharp aura. They will not move the head, but only moves the eyes like this and see the wall surrounding, because God has given Ophidia to senses to perceive the threat and danger by the senses, and they will sense through the eyes and tongue. So always when they are speaking, they will protruding tongue to and fro, letting of tongue to and fro. This is the senses and eyes movement of like here and there without movement of the body. And they have constantly fear and delusion and perception about spied on. Okay, everybody is looking me, watching me. CCTV camera, big boss में जो होता है ना, yeah, you are under the watch, you are under the surveillance of the surveillance. कि तुम्हारी ऊपर कोई नजर है, कैद है. They are always being watched by somebody. This is a spied on. Another is the Aqua marina and Medorinum. spied on. So all Ophidia has this spied on, loquacity, quick claim, secondary extroverted, and the suspiciousness and manipulation. Suspicious and manipulation. Shanky. Jealousy. Suspicious, jealousy. उसके पास है तो मेरे पास क्यों नहीं है, उसके पास है तो मेरे पास होना चाहिए. Sexuality. Envy, suspicious, jealousy, manipulation, loquacity. Another thing, all Ophidia are that basically they are timid, but in survival, for that they are becoming psychosis strong. Another thing, night aggression, sleep into aggression, aggression into sleep. रात, इस रात की सुबह नहीं होगी. रात is very tough for that. And exact opposite, they are Nishacha. They are night roaming people. All the complaints, aggravation into the sleep, sleep into aggravation, and night aggravation is syphilitic. Cheerful, active, roaming at night, Nishacha. Communicative, expansive. 1 मिनट की बात बोलने में 10 मिनट लगा देता है, सीधा टॉपिक पे नहीं आता. They can start conversation like this. Few days back, I was in theater and Dr. Keir met me and we go here and there. We purchase something. He gives me card. Then I think. Then I come to here and then start with the cheap complaint. भाई सीधे सीधा बोलना कि क्या काम है. Communication very expansive. This is a communicative, expansive people. Loud talker. Their voice are high pitch sound. Loud talker. Like a Moschus, Agaricus, Sulfur, Perisportifolia, Stenum. Loud talker. Another thing, hypersensitive and intolerance of the tight clothing. They will not wear the tie, shirt. First button is always open. Never wear the scarf because this is the sensitive areas of the Ophidia. Nausea by tight fitting collar must loosen because the pneumogastric nerve and the sensitive area that stimulate the stomach and that causes the nausea. This is the sensitive areas of the Ophidia, throat pit, throat and internal as well as external. Very important, they are syphilitic bleeders. Coagulopathy, blood, fibrin alter, hemorrhagic stroke. We will see one case of on-time hemorrhage later on. Another thing, Ophidia people are very competitive. Want to win. Life is race, competition, lots of competition. Then they will start for the advertising. Advertising to beat another person. Competition. 3 Idiot में आता है ना, life is race. भागो, दौड़ो. This is the Ophidia. Another thing, this is a very interesting thing, revenge. Revenge and hatred. Snakes are known to take revenge. And this is what Sir was always saying. I am practicing since last 17 years and since 2003 I am practicing predictive homeopathy since Birla Matusi or treating incurables. That was my turning point when I shifted to predictive homeopathy. And Sir was strong belief of the astrology and this whole Kalsar dosh. And snakes are good as well as the bad. Kalsar yog and Kalsar dosh. Worship and curse, revenge and this thing. In family, parents or somebody or itself, those who have killed snake or once in fire, we have heard the lots of the history of regarding snakes in dreams, illusion, fear, in real history, they have killed the snakes. That energy take the revenge in sense of either they will cut off your progeny and make you suffer from certain grave disease, cardiac, renal, or any degenerative disease or malignancy, genetic mutation, because they have tendency to take revenge. Same thing happen into the patient, they will also take revenge. Any incidents happen, they will keep into the dart. આપણે કાઠિયાવાડીમાં કહેવત છે, કોકે કંઈક કર્યું હોય તો દાઢમાં રાખે, બદલો લે, ભૂલે નહીં. Nitric acid, cut off the hatred, and this is like they will take revenge. આજે થયું હોય વર્ષો પછી બદલો લેશે. Even the years after, there is that store in the mind, and then will take the revenge whenever they get chance. This is Ophidia. Revenge and hatred. Grudge એટલે અંદર ખુન્નસ રાખવી. Inclined to have a secret grudge. You don't know. Okay, you can feel this is a very safe, but they have inside that grudge and revenge, and they will take the revenge. South movie, you will see that they will take the revenge. When this Ophidia go into the psychosis to syphilis, then they start ESP, extrasensory perception, like a trance, clairvoyance, prophecy. This is the extrasensory perception. They can feel, perceive beyond the normal human capacity. We have 5 senses, but they will active the pineal gland, 6 senses, and they will receive what normal human being cannot receive, like final destination. We have seen the final destination, they can understand what will happen into this is the clairvoyance, involuntary information in the brain. कुछ होने वाला है, कुछ गड़बड़ है, वो उसको पता चल जाता है. This is the clairvoyance, ESP, extrasensory perception, and fancies exaltation of. Trance, coma, meditation, religious spirituality. This is a voluntary person go into the psychosis to syphilis. Like a trance is a state, it is like a comatose state, but voluntary go into the meditation, sadhana, pranayam, sadhana and meditation, and you are the cut off from this world and go, and where your control, you loosen your control, what happened you don't know. This is like a trance state, and same thing happened, many patients we see into the ICUs, they go into the comatose state. Why they go into the comatose? What happened is important, but why is very important. So always you will see in Ophidia, trance, coma, meditation, religious, spirituality, prophecy, and intuition. Intuition આવે કે કંઈક થઈ જશે આવું. Beyond the realms of reality. This is the when you cut off from this world and go into the out of control, voluntary or involuntary, this is syphilis. So how the Ophidia in our clinical practice we can understand. And another thing, very imagination. In our footnote number 9, there is written footnote number 9, any mere imagination is sufficient to alter the vital force and can produce the morbid phenomena in the constitution. This is wonderful things. This is in case of the genetic mutation, structural pathological cases. Science says and patient says what is happening, but why is happening we have to find, and why is only happening because of certain cause, and that is in Ophidia this all are the illusion. And imagination is nothing, imagination and delusion is nothing, but it is a faulty nutrition, and faulty nutrition is nothing but it is a genetic mutation and alter the protein synthesis in our body. That is known as this genetic mutation has been occurred because of the faulty nutrition, and we have to find out what is the faulty nutrition, what the wrong information, and what is the imagination and perception as given by this constitution that arise all the process. And if we remove that information, we we will clear the case, whatever the case, like a genetic mutation, cancer. So we have to find the what is wrong rather than what is wrong. It is also important, but why is wrong and what make it wrong? Who is the culprit? This is the imagination, delirium, delusion, insanity, all kind of the persecution. पीछो छोड़े ज नहीं. This is a persecution. Persecution of the lords of Ophidia is a lords of the persecution. Like footnote number 9. એમાં લખ્યો છે footnote number 9.
એનું નામ નથી બતાવવા ખાવું છે.
These are nothing but caused by because of faulty imagination, and the same imagination can reverse it.
Okay. Footnote number 9. Lots of the persecution regarding church. Ghost, spirit, dead, snake, Satan, phantom, imaginary. These all are the not really imagination or something not visible. This is not scientifically, but this is the persecution of the Ophidia. Dreams, fear, delusion regarding many kind of the different snakes. I can say dreams of snake, fear of snake, dreams of snake, where we can understand by the miasm in also in the dream. Sir is beautifully explained the miasm in dream. What we see in the dream is a subconscious, but we can understand the process whether it is soric, psychotic or syphilitic, and dreams of snake represent the autoimmunity. Here the something syphilis is going on, you have to be very careful, and after prescribing medicine, dreams of snake should be clear. First follow up. I ask in my practice, dreams of snake गया तो गया इतने सालों से नहीं जा रहा था अभी गया दिखता था वो गया आ गया ओ नारायण नाग बलि करवाया अर्धकाल सब दोष करवाया नहीं जा रहा था त्र्यंबकेश्वर गया बराबर इससे गया ये कैसे हो सकता है this is a something beyond where you cannot explain and it is very difficult to understand for the layman people. Dreams, fear, delusion regarding many kind of the different snake and motion of tongue lapping to and fro, loves to wear a neon and radium color for the attraction. Ophidia wants to wear the beautiful clothes, beautiful ornaments, but same time they are बस कभी किसी को मिलने का होता है ना तब तैयार होके जाता है बाकी जैसे ही घर पे गया रिलैक्स होना they are very uncomfortable by clothes, ornament, earrings and everything. Sir is mentioned in the lachesis. Loves to wear neon clothes, radium color, and these are the attractive color. The attraction, sexuality, jealousy, revenge, loquacity, loud talking, leaders. These are the common entry points of the Ophidia. Ophidia deceive the death also. मौत को भी चकमा आईसीयू में से वापस आता है. Can you sense this is wonderful things? Dr. Suketu Shastri has said me, whenever you think Ophidia, you can ask by confirmatory point, can you sense the opposite person in first meeting? Yes, I can sense. Sense means किसी को तुम मिलते हो तो पता चल जाता है कि आदमी कैसा है. We are rubric sensitive to certain person. Netram is drug. But this is a Ophidia. All Ophidia has these senses. They can understand an opponent. कि सामने वाला कैसा है. This is a sense of Ophidia. Ask this question before giving to an Ophidia. And one more point he has added me. Vastu consultant is one of the characteristic of Ophidia. Also sulfur. Now this is a wonderful things. Clinical experience. What I have experienced after learning from sirs and different sources, whether it is Clark, Synoptic, my friend Dr. Mukul Sohagia. He has also made me understand this Ophidia very well. You can see
Curly
both are the Ophidias. Curly hairs,
Curly hair.
curly hairs, hairs is a receptor, and smooth hairs. This is the physiognomy. Smooth hair shows a low affection warmth. When hair becomes lusterless, thick, fibrin excess, keratin excess, then it is a lack of the love, hardness, and when become curls, that is a confusion and lack of love, confusion, and that's why you see the curly hairs. You will see the mesothelium, magnesium in laboratory. Mesothelium and magnesium, and chocolate is also like this and this. Guchru, પપાવીને આવ્યો હોય તો પેલું સાફ કરવામાં ચાલે ને એવું. But Ophidia have curly hair. You cannot understand the person. They are very manipulative. This is a curling hair. But I can understand.
Because you are same.
So we can learn from the different source, and when we apply the clinical practice, and we can make the result in a grave pathology which is beyond limits. And I will show some cases which is very easy. It was not only for the Dr. Vijay sir, but Vijay sir was always saying it is not more my monopoly. What I can do, you can also do and apply in such grave disease, in CP child, Down syndrome, genetic mutation, which was the beyond limit when I was past. And I was only thinking, book mein sab likha hai, but now it is a really happening in practice, very easy. Clinical experience, thought and thought around pathology. This is very important. ENT, ENT. Now understand this thought. You can understand from the layer-wise layer, ectoderm, endoderm, and mesoderm. There are lots of the disease from ectoderm, endoderm, and mesoderm. Like ectoderm, outer surface ectoderm, you will see ectoderm, lichen planus, leucoderma, which is arise from the dermis. But in ectoderm, you can see leucoderma and psoriasis, lichen planus. These are the disease which is also called autoimmune disease and around neck. But in this disease, you will find peculiar appearance of the motile appearance or like a snake-like pattern. And internally, muscles, also sternocleidoid muscles, or in the throat pathology, like a larynx pathology, thyroid pathology, cancer pathology, psoric, psychotic, syphilitic, you can find a lots of the pathology around neck, sensitivity, psychosis, and syphilis. Sensitivity also you can see psychosis, constriction, stricture, contraction, stenosis, elastin excess, lots of things around neck and inside neck. And another syphilis like a malignancy, lupus, cancer around the neck and inside. We have wonderful rubric, general cancerous affection, colloidal, lachesis is there. Colloidal. Colloidal is a kind of the autoimmune process where occur into the colloidal cell. Histopathological, you will find the cell. And liver cancer, autoimmune liver disease, colloidal. You will find from the Wikipedia. Okay, what is a colloidal? I will explain later on. Colloidal. Throat and throat around pathology. Chewing problem, deglutition problem. We can see in the CP child. Lots of the CP child, they have problem in the deglutition. Why this occur? This is also because of the doctrine of signature, affinity, and toxicology of the Ophidia, because they have to fear of being a poison, delusion of being poison, and he has been poisoned. There are the lots of the Ophidia. Also Plumberman, Lab CB, Rustox, Semicifuga, and lots of the Ophidia is there. That's why they have fear. They will, any disease is nothing but only defense mechanism to survive. And we have to understand what is a miasm, what is a pathology. Then we can understand what is a miasm, what happened, elastin excess, less, synthesis, proliferation, or genetic mutation, or 7 type of the syphilis, or auto necrosis, apoptosis, apolysis. This chart we have to keep in our mind and understand the area, and then the differentiate the different kind of the ophidia. I will differentiate each and ophidia. Any pathology report lesion like a snake and serpentine pattern. Understand this thing. We can understand this by like a vitiligo or leukoderma. But in internal Crohn's disease, when they shows it was like a serpentine pattern. Any X-ray reports, you can see like a serpentine pattern. This is ophidia. And when you see the ring-like pattern, think of sepia. This is something polarization. We will talk later on that polarization in sepia. Why the ring apparent pathology? And in snake ophidia, any pathology report lesion like a snake or serpentine pattern. This is a corkscrew. Oh, સોડા કે વાઇન કે ખોલવા માટેનું જે આવે ને, this is coarse. It is not normal screw, but it is coarse screw. Is this like this? Any structure which is a deform or distortion, either elastin excess less, fibrin excess less, it appear like distortion is a syphilis. Sorosyphilitic. Psychosyphilis. Distortion is psychosyphilis. And why in ophidia this happen? Try to understand. We can see into the esophagus, we can see into the spine, because ophidia have a constant threat from the behind. Someone is pursuing. There is a danger from the behind. Outside, someone is there behind. That's why they are always trying to watch from the behind. Persecution. This all give rise to the structure to defend and see. Also, this is I have to add this point. Ophidia have squint divergent. This is because of they are suspicious like this. They will see like, then the body will start to produce that kind of the structure. When you see a person with a squint eye, structure is this is not normal structure, it is deformed structure. But why is happen? You can ask ophidia, what is suspicious toward the right side? What is suspicious toward your wife or husband? What is suspicion in the business? Right side is a business side. This is a family side. So where is a squint, divergent squint, this side or this side? The same thing happened. Corkscrew, it is because of they have illusion of being poison, के जो खाने में कुछ जहर आ जाएगा, कुछ है, तो उसकी वजह से they will start to protect by the excess of the elastin. Then food goes, excess of elastin, food goes, and structure become like corkscrew. I will show the figure in esophagus corkscrew, hiatus hernia, GERD. But when you see the motility and structure in barium, you will see this is like a serpentine pattern, and this is like corkscrew. And why it happened? That is because of the excess of the elastin. You can see in the ellapse, corkscrew. पानी पिए ना तो भी like, because esophagus has this kind of the structure, they will not go directly food pipe, wind pipe. Also that torsion, distortion because of the excess of the elastin. You can see also in the congenital deformity of the esophagus and trachea. But find out in the mother why it happened. This is corkscrew pathology: constriction, stricture, stenosis, contraction, elastin excess. Another clinical entry point: affinity, tube, canal, duct. This is the area of the affinity of the ophidia. Now tube, we have lots of the tube: fallopian tube, duct, bile duct, pancreatic duct, canal, intestine, all are prepared from the stratus and columnar epithelium or lining uh, that make the constriction and stricture and stenosis and fibrin abscess, that is a ophidia. बंद कर दो. This is something danger from the ear. Ear need to protect for that type of the constrict in either GIT, respiratory or urinary stricture urethra. There is danger from. There is something is danger from outside. That's why bodies try to constrict. The tube cannot duct pathology. Another thing, clinical cancerous affection following. We have rubric. There are the four medicine. Among that, one of the lachesis is there. And another menopause, climatic affection. All the complaints aggravation after suppressed discharge any kind and relieved by elimination of the discharge. This is also important because, and I would like to say, we cannot talk about Ophidia without circulatory system. They have strong affinity on the circulatory system, and nowadays lots of the people are taking anti-hypertensive. Suppression of the discharge, suppression of the menorrhagia, metrorrhagia, कुछ भी toxins बाहर निकलता है उसको suppress करता है, then body will try to accumulate and then you will find the pathology. And always Ophidia says एक बार બધું નીકળી જાય ને પછી રેડી થઈ જાય. Whether it is mental catharsis, physical catharsis, elimination, detoxifying of any kind of the discharge, that is whether physiology or pathological discharge. This is Ophidia. And that's why they will affect after menopause. And natural physiology has been stopped and they will affect never well since that of climaxis. This is caused through like a barium serum, you can see like a esophagus is caused through, and John Pendelia has been given the why it happened. This is a kypho is like this and scolio is like a structure. And spine turns, normal spine, curvature of the normal spine has been changed because of this thing and it becomes coarse through vertebra like a distortion. This is out of the suspiciousness from behind. Clinical experience, another. When we find the birth history, we can see cord around neck. Many people, many child born with the cord around neck. This has indicated this is a sensitive areas and mother does not want to continue this pregnancy. They want to kill the one child, and you will see also after giving birth, snake also kills one child and eats one small young ones. Cord around neck and sensitive to neck. Poison feeding during pregnancy throughout 9 months, vomiting, and vomiting and nausea is syphilitic. This is something when there is an undigestible chunk of the anger and disgust, you will start to nauseate. You can ask what was the disgusting and what was the anger in the mother and what was the poison feeling during pregnancy that you are starting to producing the vomiting and nausea. Otherwise, it is not through 9 months. Cancer, malignancy, progeny, genetic mutation associated with torch virus, torch positive and different virus. This is also interesting. Nowadays, we can see lots of the child suffering from the different kind of the genetic mutation, and you will find torch test in mother, and you will find the virus toxoplasma, rubella, cytomegalo, herpes, and that virus transmit from the mother to the child. What Hahnemann said in the miasm, Sora has been bloom, activated miasm, silent સુસુપ્ત અવસ્થામાં જો પડ્યો હોય miasm active થાય અને એ same virus is also nothing but it is a breakage of the RNA and DNA. It is a breakage fragment which was in silent form of the root of the basal ganglia, herpes virus. which situated in the root of the basal ganglia, toxoplasma, cyto, herpes, rubella, and 5 to 6. Certain viruses are the psychosyphilitic and certain are the syphilitic, and they have special affinity to attack on the soft tissue, nerves, heart, and brain. We will see that torch in next slide. Discharge ammunition. Okay. Next. Pathological rubric. Milk lactation venomous. We have rubric. माँ के दूध में भी जहर आ जाता है. माँ के दूध में बच्चा दूध नहीं पी सकता, उसके दूध में भी जहर आ जाता है. Milk lactation venom. This is a changing of the biochemistry of the normal milk in mother, which was the for the survival of the child. Now it has been poisoned, and then the child has start producing the pathology or anything physiology. Then start the structure and pathology regarding of the GIT or liver because of the starvation or because of the he is not getting the milk. And the rubric chest milk lactation venomous. Borax, Crotalus horridus, Lachesis valeriana. Neck goiter toxic. Neck pathology. Mind, mania, madness alternating with hemorrhage and menses. Virus and Ophidia. Crotalus horridus. Crotalus horridus. Leukemia. Malignant jaundice, leukemia, broken down constitution by the gonorrhea or syphilis. It affects the blood, very slow zymosis. Dhime dhime, delirium sepsis from, neuralgia sepsis from, Crotalus horridus. Now, why this happen? Why the constitution of broken down? A virus which was transformed from the mother to the child, which was the silent, and then they are active and then start producing the degeneration in the same constitution very slowly. Toxoplasma. IgG shows the past infection and IgM recent infection. Toxoplasma, CNS, brain, retina, lymphatic tissue. Rubella, fetal death, congenital deformity, fetal eye drops, heart नहीं बनो, kidney नहीं बने, और वो तो एमने नहीं रहे. There is a reason behind that, and virus is a reason for the science, and for us reason is a beyond science, and is nothing but a footnote number 9, imagination and perceptions and for nutrition. Cytomegalovirus, cytoplasm, epithelial mucosa, salivary gland, herpes, root of the basal ganglia. Next. Now, let's start with the, of course, all know about the lachesis. I will not talk about more lachesis, but what the clinical entry points of the Ophidia, how we can understand what is the basic of the Ophidia. Now it is very easy to understand the differentiation. Once we enter the Ophidia, once we understand the Ophidia, then it is very easy to understand the lachesis, centris, viper, crotalus by the affinity and peculiar characteristic of each Ophidia. They are very loquacity, jesting, complaint, and verbal winner. My friend Dr. Asif says they are always loquacious and they are verbal winner. You cannot fight verbally with Ophidia and like lachesis. You cannot win. They are the verbal winner. बातों में तो वो तो हमेशा सबसे जीत जाता है. Increased sensitivity of clothes allows the decoration, wearing gold, silver, platinum rings, but at the same time they cannot tolerate the tight clothing, loosen the clothes. People who achieve very fast in their life, people achiever, you think this is Noxomica, metal, they can achieve very fast out of the with the intelligence and manipulation. They are achiever. And in psychosis, they use the advertising to win the race. कोई आगे नहीं निकल जाए. Aggravation sleep during sleep, religious hallmark on the face. This is the psychosis of the Ophidia. They are very, very religious, and they all the Ophidia wants the salvation. Salvation, moksha चाहिए, moksha. One patient asks, सर आपका क्लिनिक ऊपर है? मैं तो कहाँ? क्योंकि कि वो वैकुंठ धाम में, अक्षरधाम में. ना ना वहाँ पे कहाँ होगा? क्योंकि मोक्ष के बाद मेरे को दवा चाहिए. मोक्ष भी चाहिए और दवा चाहिए. Then love seeks for the salvation. Seeks salvation. Religious, spirituality. Religious hallmark on the face. Hyperstimulation. Positive locations, changing subject quickly. Very intelligent. Idea flows, talks. Communicative, expansive. Attachment is very strong. Jealous, self-centered, suspicious. Suppression of discharge and sensitive type clothing. This is common of the legacies. Now some rubrics, clinical rubrics, what I have used and prescribed legacies like delirium loquacious, delirium night, fever during, mind quarrelsome, scalding, fever during, larynx, trachea, suffocating, feeling, throat pit, blood clot, straw like chat, delirium sepsis from blood thick, hemorrhagic pathology. Here you can understand by the blood report, platelet is very low. ITP, idiopathic thrombocytopenic purpura, hemoglobin. When platelet is low, then actually there is a blood become, there is chances of the bleeding, and it is a bleeder. Only not a bleeding from the outside. Here the internal changes has been occur because of the less of the synthesis of the fibrin, and the fibrin has been altered, and the weak and fragile of the elastin of the vessels, and you will find the internal or external bleeding, but blood report you will see less of the platelet. It may be also affect the bone marrow. Hemorrhage pathology, desire solitude. Crotalus horridus. Crotalus horridus. I can say very snappish or angry snap. Snappish or angry snap. And they have parenchyma, affinity on the parenchyma. Liver parenchyma, lung parenchyma, kidney parenchyma. In common lots of the patient in our Surat team as a treated COVID patient, 90%, 100% fibrosis of the lungs with blood thick, coagulation with cross and lachesis, fibrin excess, and D-dimer, ferritin more than 10,000, 12,000. This is a blood thick, fibrin altered, coagulopathy, coagulation, hemorrhagic tendency, and this is a parenchyma, snappish and angrish. They are very sharp business acumen. Sharp business acumen. Like a phosphorus, they are sensitive, but very sharp business and clinic. Snappish answer. તોછડાઈ દી જવાબ આપશે તમને. હું પણ કેસ લેવાનો કાંઈ જરૂર નથી, એમને દવા આપી દો નહીં. You feels કે this is chamomilla, Erenia hexabola. This is snappishly. Answer snappishly. You can see the rubric. Answer snappishly. Angry, snappish answer. Obstinate, quarrelsome, scolding, aversion to family, hunger, aggression, misanthropy. Misanthropy is the syphilis of the Crotalus horridus, like a natrum carb and nitric acid, anacardium. Aversion to mankind. કોઈ પ્રસંગમાં એમાં કશે જશે નહીં. Not out of shyness, bashfulness, but aversion to mankind. નફરત, hatred, એની ઉપરનું misanthropy. Aversion to man. માનવ જાત પ્રત્યે માનવ જાત જ ન ગમે. This is a misanthropy. Organ parenchyma, kidney, liver, brain. We have one rubric, malignant jaundice. Malignant jaundice, skin discoloration, yellow, and even in hemorrhage of Crotalus horridus, hemorrhage from the all the orifices of the body. All the orifices, even not the orifice, but even a minor orifice where the sweat glands secrete, you can also find the bloody sweat in Crotalus horridus. Another thing, lachesis and Crotalus horridus, bloody sweat. Even sweat gland also secrete the blood. This is a zymosis. You can understand the zymosis. You can understand the Crotalus aureus. And zymosis is nothing but it is a slow decomposition of the body because of the syphilis, gonorrhea, and virus that produce in kind of the HIV patient. HIV patient slow progressing zymosis, carbon and Crotalus viridis. Zymosis, dengue, fast progressing zymosis. ઉંદરવાળા હે ને સુરતમાં જે પ્લેગ મરકી કાલા આઝાર એચઆઈવી ડીઆઈસી disseminated intravascular coagulation malignant jaundice. There was one case, a child affect the jaundice હિમોસિસ્ટિનોગ્લોબિન્યુરિયા કે એમાં એને લીવર અફેક્ટ થયું, જોન્ડિસ થયું, કર્નિકટસ થયું, બ્રેઇનમાં ગયું અને કોમામાં બચ્ચાનો તો કોમામાં ગયું. And this jaundice was not a simple physiological jaundice, not a structural jaundice, but it was the out of control that affect the another organ. And there always you will find liver to brain is zincum and Crotalus viridis. By Crotalus viridis, SGPT, SGOT, LDH, fibrinogen, everything was normal. Child come out from the coma and the jaundice clear and the blood was also improved and he survived for the 1.5 years. Then they transplant bone marrow against the advice, don't do it, and then bone marrow sepsis and child died. Organ parenchyma, malignant jaundice, leukemia, broken down constitution, blood, dark fluid, hemorrhage from all orifices, bloody sweat, and Crotalus, lecasis and Crotalus, hemorrhage from the eyes, intraocular hemorrhage, right side Crotalus, left side lecasis, intraocular hemorrhage. Black discoloration of the skin. This is also interesting things. In Ophidia, you will find psoriasis. Psoriasis is a scaling disorder. And snake has a characteristic of scale their skin and shedding of the skin, especially in the after winter has been finished and summer has been started, and that particular period is a March, and that is known as a spring, and they have an annually shedding of the skin. So you will find in all of India annual periodicity, fever, neuralgia, ulcer, or any pathology. Different Ophidia has a different pathology. We will see in Shankris. Another thing, neuralgia, sepsis after. Never well since that of the sepsis is a pyrogen, but delirium sepsis and neuralgia sepsis, only Crotalus viridis is there. In clinical practice, we can see trigeminal neuralgia. એની પહેલા એને રસી થઈ ગયું હતું, એ હારું કર્યું, દવા લીધી, એની પહેલા રસી થયું હતું, સેપ્ટિક, ectoderm, endoderm, and now this is a neuroectoderm. It has been affected. Now you can and you can understand what happened first, and then after, then you can understand the generalized neuralgia, sepsis after. You can think of Crotalus viridis. Leukemia, broken down constitution, malignant jaundice. एक मिनट पाछा HIV, disseminated intravascular coagulation, plague, COVID-19, zymosis, hepatitis virus, neuralgia, sepsis after. And please. In my clinical practice, I have seen many kind of the hepatitis A, B, C, D, E virus which affect the liver and not produce only jaundice but also produce the cirrhotic changes in the liver, and then the time come as to transplant, and they have revised by the Crotalus viridis 50 m single dose. 3 to 4 cases I have seen in my clinical practice. Malignant jaundice. Okay. એક મિનિટ પાછળ. Second, PVL and myelomalacia. Now PVL, periventricular leukomalacia. In brain, softening of the brain, periventricular leukomalacia, myelomalacia. This is a degenerative changes in the myelin sheath and into the brain, where brain parenchyma has been affected, and also back. You can see the rubric, weak back in myelomalacia. See the rubric, you can see weak back in myelomalacia, crotalus horridus. Another thing, heel do not touch while walking. Toe walker, crotalus horridus. Heel do not touch to the ground, lathyrus and crotalus horridus. Crotalus cascavula. I can say spiritual snake, imaginary snake, illusionary snake, extrasensory perception snake, religious snake, illusionary Ophidia, phantom, imaginary. You will see the lots of the imagination. You can see, you can think this is the cannabis, this is a drug, this is a phantom, imaginary, what really is not there, they perceive, and persecution, lots of the things. So you will find the lancinating pain. તમને લાગે કે ન્યુરાલ્જિયા છે, lancinating pain in this thing, uterus neuralgia of crotalus cascavula, uterus neuralgia of neuralgia, trigeminal neuralgia, migraine, headache. You will find MRI, nothing. This is a phantom, imaginary, illusionary Ophidia, and they have extrasensory perception. Like you say, fancies exaltation of people who sees the ghost, monster, spirit, hears them, talk with them, hears footstep, most hypochondriacal snake, hysterical snake, hypochondriacal snake. They have lots of the hypochondriasis, like they can hear. This is known as a infrasound. Infrasound means they can hear a finer movement and sound. Clairaudient is also anacardium, nux moscata, crotalus cascavula. But infrasound के दूसरी रूम में कोई पैर की आवाज आता है, आहट, रामसेना मूवी, बोला दरवाजा નો અવાજ, કે ભાઈ ત્યાં કઈક છે, અવાજ આવે છે, તમને એમ જ લાગે. When you consult the crotalus cascavula, you understand રામસેની મૂવી ચાલતી હોય ને એવી, ખબર છે ને, ભૂતના પિક્ચર ની ના તેમ એવું. This is the hypochondriasis of cascavula. Monster, ghost, spirit. मरे हुए लोग आते हैं, बातें करते हैं, बोलेंगे खाना दो, ये वो खाना देती हूँ, बातचीत करता हूँ. Talks with spirit. Illusion talks with spirit. I think 8 medicine is there. Okay, 28. Spirit near them, talks with spirit, hear the footsteps in next room, hypochondriac. Like staphysagria, whenever there is a anger, this is like a natrum, like a grief, and staphysagria like a anger, they cannot retaliate. They have to grudge the wall the inside, and this is the crotalus cascavula. And the affinity of cascavula is the thyroid, Hashimoto's thyroiditis, uterus, circulatory system, and psyche, and hypochondriasis. This is the affinity of the cascavula. Another thing, those people who see the guru, dreams of guru, spiritual leader, આસારામ બાપુ બી કોઈના ગુરુ, આસારામ બાપુ હોય તો એ બી સરનામ આવે, જેના જે ગુરુ હોય એ આવે, પણ ડ્રીમ્સ ઓફ ગુરુ is a cascavula. Strong need of the spiritual leader and God, Krishna Bhagwan આવે, દેવી દેવતાઓ આવે. And another wonderful things is the illumination light. Written down, this is illumination. Now the meaning of illumination, you see the figure of God. We have lots of the in Chabi, God is there, and behind that you feel the light. There is a strong light, luminous. A luminous light આવે છે ને, આ બધી આ રેડિયમ લાઇટ ને આ બધી લાઇટ બધી આવી ગઈ, there is a prakash, jalhalto prakash, valeriana in cascavella. This is also illusion, hallucination, and into the dreams of illuminous light, spiders, strong need of the spiritual leader, dreams, delusion of skeletal and corpse, murda, skeletal, black gigantic skeletal. Another magnetic state. Magnetic state यानी मैग्नेट यानी लो चुंबक. They feels कि मैं जहां जहां जाता हूं ना वहां पे लोग मेरे तरफ खींच के आ जाते हैं. खींच के आ जाते हैं. That means कि you are attracting that things as if you are magnet and you are attracting that guys. This is a like a strong magnet. Also, there was one case. चलती हूँ तो मेरे पैर उठते ही नहीं, बहुत भारी भारी हो जाता है, जैसे कि ये जमीन से उठते ही नहीं, वो चुंबक की तरह कैसा खींचता है ऐसा. As if we have rubric leg heaviness, as if heavy weight as of a magnet cannot lift from the earth, as if they are चिपक जाता है, as if magnet. Lidum, phosphorus and cascavella, androctonus. And phosphorus, lidum, cascavella and androctonus. Cascavella. Delusions in the skeletal and corpse. Generality, food, drinks, no desire, snow. Deja vu experience, whatever we have seen in the Kalibrom. ये चीज पहले बन चुकी है ऐसा लगता है, ये देखी हुई लगती है. ऐसा ही इस तरीके से ही बैठे थे, ऐसे में लेक्चर ले रहा हूँ तो ये आगे अनुभव हो चुका है. Deja vu experience. This is known as a deja vu experience. Kalibrom and cascavella. Magnetic state of a personal power increase as if uterus neuralgia of I have prescribed senses. From the senses they have always senses hyperactive. It was the case of the morphia, and there was the, I can say the slide only बता, ladies नहीं है तो morphia કે સ્કિન આખી બ્લેક થઈ ગઈ હતી, કાળી થઈ ગઈ હતી અને ઇલાસ્ટિન ઓછી થઈ ગઈ હતી અને ફાઇબ્રિન સિન્થેસિસ વધી ગયું હતું. There was a typical એક સ્મેલ આવ્યા કરે છે, કોઈ નથી આવતી, જાણે ઓલી હોસ્પિટલમાં સ્મેલ હોય ને એના જેવી સ્મેલ આવે. This is the illusion of a smell as of a hospital. Crotalus cascavella was given. This slide માં right, slide માં ફોટો બતાવો. વિડિયો સ્લાઇડ છે ને કઈ જોડે ઈ સ્લાઇડ બતાવો બોલો. NASA. I can say dignified good snack. This is a different share because this is our Indian culture, mythology. આપણે એની પૂજા કરીએ, દૂધ પીવડાવીએ, કેટલા આપવાની છે. You can see lots of the people have a snack behind the truck, behind the car, and also કેટલા આપા ચા. This is a religious, anxiety conscientious, religious snack and dignified snack, noble snack, honorable snack. Anxious, anxiety conscientious, delusion, neglected beauty. हमेशा ये नाजा के अंदर दो चीज रहती है, डिल्यूजन डबल व्हील, ये करो, टू व्हील, स्प्लिट ऑफ, हेड इज डिवाइडेड इनटू टू, ऑलवेज रॉन्ग सफर्ड, कुछ मेरे से गलती हो गया, ये नहीं करना चाहिए था, ये मेरी ड्यूटी थी, वो मैंने जैसे वरम कहता है ना, ये मेरी ड्यूटी थी वो नहीं की, ये सब उसमें रहता है. ब्रूडर स्नेक, ब्रूडर, there is a brooder snake. Brooder यानी they always brood over the imaginary thing, brood over imaginary things. Dignified, and there is a special affinity on the autoimmunity and mitral valve pathology. You will find with the very few symptoms. That is known as a pathology with the paucity of the symptoms. mitral valve pathology. Nervous system, medulla, cerebellum, brainstem. This is affected by the NASA, and they have a failure and unsuccessful, like a germanium metallicum, like a yellows failure. This is a guilt, anxiety, conscientious of self-depreciation, reproaching self, blaming self. It is because of me. This is a autoimmune snake. I can say it is a autoimmune snake, dignified snake. We will see the next slide how the autoimmunity appear in the NASA. External throat constriction. This is typical. Sternocleidoid mastoid muscles. This is external throat constriction. Constriction is arise out of elapse में constriction અહીંયા આનું constriction અહીંયા અને esophagus માં we have oblique esophagus constriction, spasmodic stricture of esophagus, nasa and spasmodic stricture of the sternocleidoid mastoid muscles, nasa, like lecnanthus. We can see the torticollis. But torticollis, why torticollis has been affected? What has been affected? Which structure has been affected? And here the external throat constriction, sternocleidoid mastoid muscles, esophagus spasmodic constriction of. Mind, delusion, imagination, images, phantoms is wrongdoing possible. This is a strong delusion. Two delusion is very strong in NASA. NASA developed the lots of the pathology surrounding head. It may be produce the tumor, glioma, glioblastoma, and neuroma out of false perception of delusion. He will receive injury to head. So body is try to protecting that will produce synthesis, more fibrin and proliferation. That's why they develop tumor on the head. Head tumor pathology. And another, exact like a center, like a magnesium, that will affect because two will. This is the confusion and division of two things. Double wheel, they always develop in between pathology or one-sided right side. Mind, delusion, imagination, neglected duty, headache during delusion, imagination, misfortune, over a possible. This is not. Over calcareous self, alumina, lilium tigrinum, and this is a possible. Possible એટલે like a कोई भी एक चीज के बारे में ऐसा हो जाएगा, ऐसा हो जाएगा, ऐसा हो जाएगा, ऐसा हो जाएगा, लेकिन उसकी जितनी संभावना होगी, पॉसिबल એટલે શક્યતાઓ. છોકરો ઘરે નથી આવ્યો, અહીંયા ગયો હશે, અહીંયા ગયો હશે, અહીંયા ગયો હશે, અહીંયા આ થયો હશે, આવું થયો હશે. Each and every possibility they will think about, and they have strong belief and strong perception regarding of the misfortune possible. This is the autoimmunity of the NASA. Now why? Rubric mean we can see bulbar palsy. Another thing, motor neuron disease, degeneration of the motor cell. NASA and Cureri. Degeneration motor cell, motor neuron disease, MND. Secretive, self-depreciation. You can find the degenerative changes into the knee joint, degenerative changes in the mitral valve, degenerative changes into the autoimmunity. In report, you will see HLA-B27 and CCP positive. HLA-B27 autoimmune lumbar spondylolisthesis. ANA positive, ankylosing spondylitis, RA positive, HLA-B27 positive, vitiligo, bone marrow, medulla. Illusion, misfortune, image is possible. This is right. Okay. Insanity, suicidal. By exit.
खुद के पैर पे कुहाड़ी.
खुद के पैर पे कुहाड़ी. वाह अमित, बराबर. This is a खुद ही खुद के पैर पे कुहाड़ी मार. Oligohydramnios joy. This was the case. In this case, there was the fetal-mother circulation was the affected. We cannot talk Ophidia without talking of the circulatory system. And Naza is more nervous, but this was the case of the homeopathy doctor. 7-8 month pregnancy, pre-eclampsia, and hypertension, edema, proteinemia, whatever. There was the USG finding, there was the fetal-mother circulation, there was the clot, and it was affecting the circulation. There was chances of the miscarriage and this toxemia of pregnancy. Then it will become a critical pregnancy. And I asked, when see the report, I see the child and I see the cobra. You can see cobra. See, zoom it. I ask one question. Do you get the dreams of snake? Yes, of the black snake. You could take the NASA potency, I don't know, 30. NASA 30. I don't remember. NASA 30 was given, and after 7 days, USG was normal, no edema, urine was clear. Now child is 2 years. He will become homeopathy. Okay, Ajawale. This is a fetal-mother circulation. Another case of the child. Vitiligo, autoimmunity, we see the any pathology or any disease behind, think of Ophidia. Autoimmunity, think of NASA. Oh. This was the before 2 years. 2 years. This is a recent, yesterday's report. Same. Elapse.
More poisonous than
Jawad.
short snake.
I can say lovable snake, phosphorus snake. Sir always says when you think phosphorus and carcinosin, think of elapse. Corkscrew. बच्चे में they loves to remain in a cavity. छुपा छुपी में cavity. Desire to be in cavity. We have rubric. Desire to be in a cavity. बकोल में फंसाई जाए. When you think phosphorus and carcinosin, think of the elapse. They are very sensitive, anticipatory, loves for cold drink, juice, ice cream, ice cube. Anticipatory color, loves nature, rain, like a carcinosinum. Characteristic. You can differentiate elapse from the other snake by the characteristic of the black discharge. Black. Not it is like a crocus or medorinum or magnesium. This is a typical black discharge. Whether it is a blood, whether it is physiological discharge, menses, nosebleed, any discharge which is black is a elapse. Rain aggravation, hemorrhage from lungs, black ink, brought food turned like a corkscrew on swallowing. One of the homeopathy doctor was suffering from the esophagus atresia, homeopathy doctor, and he was problem with the deglutition and always things like this. He was cured with the elapse. Corkscrew spine and esophagus. Why that we have learned in previous slide. Obias, feet. Okay. This is corkscrew esophagus. Why? Because of the excess of the elastic. This is corkscrew. Same thing happened into the spine. Okay, I will do it. Viper. I can say most toxic and dangerous snake is a viper. But wonderful after potent digestion. Viper in potent digestion, they have cured the wonderful cases like a genetic mutation and unbelievable. It is a beyond limit. I will show the two cases of the viper. Lymphangioma. Lymphangioma is nothing but it is a genetic mutation of the lymphatic system which arise in the lymphatic channel and lymphatic system. That is a tumor you can diagnose in early childhood and late childhood. Lymphangioma. Viper has a special affinity on the blood vessels complaint, increase homocysteine level. Last lecture, Dr. Amrish sir has beautifully explained in last lecture, homocysteine level, blood coagulation, blood vessels affection, that was the homocysteine level. Lymphatic system causing vasculitis, lymphangitis, genetic mutation like lymphangioma, tumor of the lymphatic system. Only viper is there. Lymphangioma. Varicose ulcer, varicose vein, varicose perforation, blackish discoloration. Only this is one of the typical of the viper. Perspiration all over body except affected part. જ્યાં તકલીફ હોય એ છોડીને બીજે બધે પાસે હોય. This is only viper. Vasculotoxic, lymphotoxic, blood thrombus, thrombi, rubric, three drug, I think Calimute, Carboage and viper. Blood thrombi, Pathak and synoptic. Blood thrombi. Thrombus means when fibrin get increase, fibrin increase, so thick type. Fibrin decrease, LDH વધે, LDH જો ઘટે, there are two things. Fibrin ઘટે અને વધે. ઘટે તો bleeding થાય, વધે તો thrombus થાય. ઘટે તો hemorrhagic diathesis થાય, અને વધે તો thrombosis, embolism, coagulopathy આવું થશે. In viper, both is there. Hemorrhagic tendency as well as thrombic. Blood thick, kidney hematuria. Mind. One of the wonderful delusion that I use many times and I get result is a delusion persecuted by Satan. Now we have to understand what is Satan, who is a Satan. In cultural order, આપણે દેશમાં બધા ભુવા, ડાકલા, માતાજી કોકના શરીરમાં આવે અને એ ચુડેલ, ડાકણ, આ લોકોને વાઇપર હેઝ અ કોન્સ્ટન્ટ થ્રેટ ઓફ ધેર પરસિક્યુશન. એ એનો પીછો ન છોડાય, એનો ડેન્જર છે, એ એને માર નાખશે અથવા they will do the sexual activity of them. And when you go into the Castelman, one of the case, Castelman વાળું છે એમાં પહેલા સાતન કહી દો. સાતન mind delusion imagination pursued being Satan by chaotic female power, chudel bhuva cultural belief that evil spirit in the body. Now there was the one case of the Castelman disease. Castelman disease is like a lymphangioma. It is a genetic mutation has been occur in the lymphatic system, arise of the Castelman's Castelman information check. Castelman Wikipedia you can see it is like a lymphoproliferative disorder, lymphangioma, lymphoproliferative disorder, but associated with this they have lymphatic body માં જેટલી lymphatic channel આવે ત્યાં proliferation ને growth ને એ બધું થાય, respiratory માં થાય, breast માં થાય, brain માં થાય કે આખા body માં, groin માં એ બધામાં lymph proliferation થાય, associated with the Turner syndrome. Associated with, you will also find Castelman with the Turner syndrome is like a X genes mutation, chromosomal abnormality. It is a missing of the sex chromosome, I think. Why this happen? Lymphatic self-devaluation, or why? What is the need to proliferation of this? Why body has to defense in the lymphatic system? Why the lymphangioma occur? What is a false perception? If you correlate vipera and this lymphangioma and Castelman disease and Turner syndrome, you can understand this is a arising out to protect of the self. This is a arise out of the protect of the self, out of the arise persecution from the Satan, and both case I have result with the Vipera 200. 200. પાછો એક જતો ને 3 case, sorry. DIC coagulation, another thing, morphinism. We have rubric. Morphinism, drug addiction, especially injection from. There was the one case of the chronic migraine. MRI was done. In MRI finding neurovascular conflict. Neurovascular conflict. There are the certain vessels ગુચરું થઈ ગયું હતું, tortus dilated આપણે અહીંયા જેમ થાય એમ થઈ ગયું હતું, અને હું અત્યારે રાત્રે એટલો બધો દુખાવો થાય કે ટેબ્લેટ થી નો મટે, પેઇન કિલર, પેરાસિટામોલ, ટ્રામાડોલ, opioid, then he need to take the injection, only relieved by the injection, and when you are in sleep it was aggravation by hanging down and relief. I think this is the out of control, and it is a addictive of the relieving of the pain, and this is a to relieve pain. This is a morphinism and addiction by injection, and only Viper is there, and Viper has affinity on the circulatory system and aggravation hanging down, emulation elevation. Viper at 200 pure, she was suffering since last 15 years. Viper at 200. Hemorrhage, actual tendency, cardiac dropsy, bleeding, black, premature climaxis. Stramonium and Vipera. Climaxis નથી ભાઈ, senility. Senility premature. Senility એટલે આપણે બધા યંગ છીએ, અમુક જે 70 80 90 વર્ષના થાય, there are the certain body change like a degenerative changes occur into the bone, degenerative changes in the body, and when you see the early childhood, this senile changes has been occurred, and you can generalize senility early. Stramonium and Viper. Delirium, sepsis, from. Toxic goiter, GBS, Landry paralysis, speech difficult, senility. Senility early, premature. પેલી પોલિસી કેમ પાકી જાય પહેલા? LIC પોલિસી લીધી હોય 80 વર્ષે પાકવાની હોય, પહેલા પાકી જાય. Angry, sluggish, very. I can say Vipera is a Barita snake. Like a dull, confused, sluggish, angry chef. But intellectual capacity is very low. They will stagger ભાગવાની જેમ. બરાબર, આમ જોયા કરશે. Slow answering, not reacting. This is Viper. NASA, diligent. Diligent नहीं, but noble, good snake. Cascavella, spiritual snake. Parenchymal snake. Crotalus horridus. Zymosis. We can differentiate. Lower limb, hanging down, limbs aggravation, varicose vein. Varicose vein, lower limb bursting, neurovascular conflict. This is the case of neurovascular conflict. Another case of the thromboid piles, which was aggravation by the walking, sitting, and when hanging down and sleeping on abdomen relief. Vein bursting full, hanging down, aggravation, emulation by elevating parts. Another thing, lymphoma of the breast, same modality. Which areas affected and what is modality, we can differentiate the affinity and modality. This is Ophidia of the Viper. Same, lymphangitis of the lower limb, deep vein thrombosis, letting limb down. This is a typical modality of the Viper. Don't forget. Hanging down, pulsatilla is also there, ammonium carb is also there. Jordan. Cystic lymphangioma. Wonderful case. This is cystic lymphangioma. Lymphangioma, tumor, Vipera. Lymphangioma, malformation. Lymphangioma is a malformation of the lymphatic system characterized by lesion of the thin wall cyst, and hygroma. Lymphatic system is a network vessels responsible returning of the venous system, excess fluid from the tissue, lymph node, and filter fluid. Pathogens, malformation can occur in any age. Later diagnosis, malformation either congenital, acquired. Congenital lymphangioma are oftenly associated with chromosomal abnormality like Turner syndrome, and although we can examine the isolation, and lymphangioma are also commonly diagnosed before birth. Fetal ultrasonography, acquired lymphangioma, trauma, infant lymphangioma, Dagimas, joy. This girl was suffering from, this is a lymphangioma, cystic tumor of the lymphangioma. હવે એને ત્યાંથી ટુકડો કાઢીને જોવે તો એ જ આવે lymphoproliferation. Histopathologic shows, biopsy shows lymph proliferation. What we see, where is the toxicity? What is the toxicity and why is the toxicity, and what is the defense of the constitution and who is the person? What is the wrong information? And we prescribe Vipera and see the result. Vipera 200. Rubric was taken, blood vessels, affection of and tumor lymphangioma. Another thing, Milroy syndrome. Milroy syndrome is same kind of the lymphatic edema and warts. This is like a verrucous plantar warts, and this is a genetic disorder. Milroy's disease is a familiar disease characterized by lymphedema, commonly in legs, causing congenital abnormality of the lymphatic system. Congenital, and a faulty nutrition, company fault, genetic mutation, wrong information, footnote number 9, imagination, find out it and remove. Information, clear. Disruption. What is, this is case of the Surat Skin Association. We are friends and they have many times cauterized, cryo, but again and again started because the process was continued. We discussed, we have scope in homeopathy, okay, give the medicine. After 1 month, clear, verrucas, lymphatic system normalized. She is a wonderful today. I will show you the case. And this is a case of not a proud for me, but this is a case of the proud for the Surat Skin Association doctor. This is a wonderful. One dose can clear the information which was given into mother's womb. This is a genetic disorder. Rubric: child anxiety, dysphoria, lymphangitis, restlessness, ailment from mortification, chagrin, humiliation. Inflammation of the lymphatic, lymphangioma, Vipera 200, 1 dose. This is the case. Yeah. एक मिनट पाछा Shankris. I will say Shankris is a fascinating, sexy, attractive, and modern, fashionable snake. You can see in Shankris no interest in household work. Understand the Shankris, then I will show you a pathological syphilitic cases easily treated with Shankris. What sir was correlating each and everything, each and every science, why this has been occurred. What this has been occurred, we can see. But sir was saying always beyond why. And why is the answer. No interest in household work, aversion to domestic duty, wear the indecent clothes that shamelessly expose the name of the fashion. Nowadays, the lots of the people, not only the girls or boys also wear certain clothes. They can expose the genitals and low waist jeans, necklace, off shoulder. अभी तो फैशन है, हावी फैशन. Wear the indecent. Indecent means not a proper. There is also sickle for Iosymas symphytum. 7 to 8 medicine is there. Indecent clothes in name of the fashion. Sickle is there. Sickle Iosymas. Wear the indecent cloth that expose shamelessly in name of the fashion. This is a copper snake, copper color. They always highlight copper headed. I have seen in my clinical practice. They have copper color, highlight करें copper color, highlight करें. They want to highlight copper color. Collar, as usual, all the snacks is a very sensitive to collar pressure of. They will not wear the collar, even ladies wear or gents wear collarless, neckless, collarless, shoulderless. This is out of the sensitivity and to the show off, and this is out of one to cut off the responsibility. Try to understand. Shoulder is responsibility. इसमें तो दो रखा है क्योंकि ये चाहिए, ये दिल मांगे मोर तो एक्स्ट्रा होगा, कट होगा तो नहीं चाहिए. What is the defense over a shoulder is the defense of the miasm, is the defense of the genetic code. Two cases, wonderful case. Breast is cut off, shoulder cut off means does not want to take the responsibility. Aversion to domestic duty. Cut off the domestic duty. बच्चा बच्चा नहीं, घर में भी कुछ रसोई बसोई नहीं करने का, कुछ नहीं, घूमना फिरना, लिबर्टी, ये वो, सेल्फिश, सेल्फ सेंटर, मजा, पार्टी, एन्जॉय, लव, सेक्स, घर का कामकाज ના એ મને ગમે તે, એ ઘરનું કરવાનું હોય તો નવું નવું કરવાનું હોય ને તો ગમે, પણ રૂટીન ડોમેસ્ટિક છે, ડોમેસ્ટિક તો this is the cut off the domestic duty. It is not in the front, it is a cut off. Sexuality, dreams of. You can also find everything in the dreams. You can find the Shankris in appearance. You can find Shankris in the pathology. You can find a Shankris into the disposition, and you can find the Shankris in the dream also. You will find the lots of the snake. Snake represent the sexuality. One of the wonderful things. Snake represent the sexuality also. And persecution of the snake, being bitten by snake, this is typical of like somebody is pursued in out of the interest of the rape. There is a threat and danger of rape. One child in 7-month pregnancy, he developed the cyst on the meningomyocele on the back. So I asked about the mother, what is a threat from behind? What is the insecurity from behind? Mother has a tremendous fear, threat. Mother was toxo positive, cyto positive, herpes positive. So that virus, RNA DNA breakage transferred by the fear and fright and the insecurity of mother that transform on the back side, and child has developed the meningomyocele of the back. There was a constantly threat of the danger, especially of the rape and terrapin. Write down terrapin. बड़े बड़े कछुए दिखते हैं. कोई आदमी आता है, जैसे कि think of rape. This is a typical dreams of sex, copulating, rape, intercourse, and mating, and bitten by snake. Now she is free from that all kind of the dread, fear, and drastically we see the regression of the tumor in the meningomyocele. Now 2 months is there before child will come into this world. We can see the normal structure by delete of that information which was given by mother. That child transferred that information, wrong information, footnote number 9, to the virus specific areas, nerves and myelin sheath, toxo and herpes. Try to understand the correlation. Okay. Dreams of turtle, delusion. There was one place कि अभी मैं इधर भी हूँ, अभी मैं बॉम्बे में भी हूँ. मैं कह दादा भगवान नहीं हूँ. मैं कहे वो बाबा अपना कया बजरंगदास बापा. एक समय बे जग्याए હોય. Lycopodium and Shankris and Cilicia. This is a delusion. Places two at the same time being in. How it is possible? I can hear. I cannot be another place. This is a typical delusion of the Shankris. And another, this is death, presentiment of sudden death. Especially at night, I will die. Soon die, like a aconite and Avenus cactus. Avenus has a helplessness feeling. Nobody can save me. Here I will die. Another, great fear of many conditions where excessive swelling is leading features. कुछ नहीं है. Whenever the excessive swelling, only you can find in history, excessive swelling is the leading feature of any condition. Think of shankrys, because when shankrys bite, that will happen. This is the water snake. Fear of pointed object like Cilician, leg phenomena, and Spigelia. Pinpoint. Self-centered, libertinism, death, resentment, swelling, edema. Typical. In clinical entry point of the shankrys, puppy swelling under the eyelids, apis mellifica, above eyebrows and eyelids is a calicab and shankrys, and around is phosphorus. Sir says nausea ammunition by eating ice cream or ice cube. Shankrys. Only shankrys. Only you can find in the repertory. Only shankrys. Nausea ammunition increase calcaria cap. Nausea by eating ice cube, ice cream, calcaria cap, ammunition, ice cream, ice cube. Constriction umbilical region. Constriction. We can find the loss of the constriction, stricture, stenosis, contraction because of the elastin excess, but shankrys has a constriction over umbilical region. Genetic confusion of the shankrys is like typically petroleum. Write down. I can say confused snake, sexy confused snake. ड्रीमी एब्सेंट माइंड गाड़ी लेने जतो होय तो क्या नो क्या पहुंची जाए, बाद में पता चले ये कहाँ हूँ मैं. As if they are in synoptic, there is written they are driving a car, took the wrong place, then finally realize where I am. Oh, પછી ખબર પડે. Like a kind of time and space perception lost. This is a place perception lost, shankrys. Dreamy absent mind, mark alteration of mood, took the wrong car without realizing where she was going. Right side. This is typical allergy and ulcer spring in. Allergy, ulcer spring in. I will show you case. Gasping, respiratory, gasping, talking while, bolta gasping, extreme. This is an involuntary mechanism. In front of you, they will unconsciously crossing the extremity. That's what called. This is observation, clinical observation, extremity crossing unconsciously. You can find into the rubric also, extremity crossing unconsciously. Only shankrys is there. In case of the genetic, what is we find the cut off the responsibility. Also in the genetic level, they cut off, and cut off at the genetic level is nothing but deletion. We have in genes, there are the many things, either replace, misplace, deletion, addition. What is happening here? The cutoff. They also cut off, and you will find a pathology, autosomal dominant disorder, and chromosomal abnormality of the Sjogren syndrome, connective disorder, and diagnosed frozen shoulder. Oh, अंदर से ही उसने बोला था कि रिस्पॉन्सिबिलिटी लेनी नहीं है, कट ऑफ कर दो. You will find after why this happened. This is in one syndrome. I will show you. Deletion, cut off. Now this is the case of the homeopathy doctor's wife. Wonderful case. Easy understanding. Understand. Oh, right. Right. MRI, shoulder, right shoulder. Right shoulder, responsibility, right husband, जवाबदारी क्या, cyst, insecurity, tear, cut off. Okay, understand. Poor visualization of the posterior labrum with the intrinsic hyperintense signal within the adjacent large cystic areas up to sphenoid notch, finding most likely labrum. Labrum is like a shoulder. अपना ball and socket joint જે છે એમાં જે લેબ્રમ છે ત્યાં કુકરની રિંગ જેવું, એટલે આરે પોળા નથી કરતા અહીંયા કુકરની રિંગ, એ કુકરની રિંગ અહીંયા આવે, આ શોલ્ડરમાં, and that is a made up of the which structure? The muscles ની છે fibers. It is a fibrous structure which has been cut off, and discontinuity and cut off is a syphilis. तो इधर अभी प्रॉब्लम क्या है? आज ऊपर शोल्डर रिस्पॉन्सिबिलिटी कट ऑफ, palpebral cyst and tear, labrum tear. ભાઈ આમાં રિપેર કરવું પડશે. કઈ વાંધો નહીં, ડોઝ આપીએ ને સેન્ક્રિસ 30 રિપેર બરાબર. Now try to understand what is normal physiology, what is anatomy, what is the structure, and what is the pathology, and what is the mind of the pathology, and what is the miasm of the pathology, and what is the affinity, and what is the defense. Correlate each and everything. It is very easy. Large cyst, insecurity, psychosis. Labrum tear, cut off, syphilis means cut off the responsibility. Neglect, aversion to domestic duty, उसमें था केस में. Then Shankly's 30 was given, it repaired. Another case Shankly's, recurrent pylonidal sinus. 8 साल से, अभी तो अमेरिका चला गया. मार्च में आए, दिसंबर में आने वाले हुए थे. ત્યાં રજા હોય અમેરિકામાં, એટલે માર્ચ, જાન્યુઆરી, ફેબ્રુઆરી રે, માર્ચમાં ઓપરેશન કરાવીને પાછો જતો રહે. પાયલોનિડલ સાઇનસ થઈ કે અહીંયા આવું છું ને, એનું વાતાવરણ એવું છે કે અહીંયા આવું એટલે પાછળ અલ્સર થઈ જાય. ક્લેફ્ટ, નેટલ ક્લેફ્ટ ઉપર અલ્સર થઈ જાય. અહીંયા ડિસકન્ટિન્યુટી ત્યાં ગયું, અલ્સર થઈ જાય. પછી પાછું એન્ટીબાયોટિક લાવો ને ઓલું સર્જરી કરીને ડ્રેસિંગ કરવું, સારું થઈ જાય. પછી ઉનાળામાં ચોમાસામાં વાંધો ન આવે, પાછું અહીંયા આવું થઈ જાય. 1 વર્ષ ન્યાય રહ્યા ને તો ન્યાય થયો, અમેરિકામાં થયું. તો ધીસ ઇઝ અ એન્યુઅલ પીરિયોડિસિટી. અને માર્ચમાં મેં કીધું માર્ચમાં શું છે? કારણે પૂછ્યું માર્ચમાં કઈ છે અલ્સરનું? તો કે નહીં, તમે સ્પ્રિંગ નાખો. તો અલ્સર સ્પ્રિંગ, ધીસ ઇઝ ફિઝિકલ સિફિલિસ. અલ્સર એવરી સ્પ્રિંગ ઇન, અલ્સર રીઓપનિંગ ઓલ્ડ સ્પ્રિંગ ઇન. Lachesis and Shankly's, allergy spring in. All Ophidia has this spring aggravation, annual periodicity, and particular Shankly's has a ulcer and allergy spring in. Shankly's 30, repair 30, 31 dose. Bothrops, ICUs. Only one thing, Bothrops is a thrombotic phenomena, thrombosis and thrombotic phenomena, and that causes the clot, and that causes the paralysis and affect the speech aphasia with hemiplegia. Write down aphasia and speech Broca's affect થાય, અને hemiplegia याने cortex affect થાય. Hemiplegia with aphasia without any affection of the tongue બરાબર હોય, પણ મોટર કંટ્રોલ જે છે અહીંયાથી જાય અને બ્લડમાં કોગ્યુલોપેથી થાય. આંખમાં જાય તો રેટિનલ થ્રોમ્બોસિસ થાય, નાઇટ બ્લાઇન્ડનેસ ને ડે બ્લાઇન્ડનેસ આવે, અને એમોરોસિસ. ઓકે, બોથ્રોપ્સ, પલ્મોનરી એમ્બોલિઝમ, થ્રોમ્બોસિસ, થ્રોમ્બોએમ્બોલિટિક ફિનોમિના, હેમિપ્લેજિયા, એફેઝિયા. કોણ છે આ? પોન્ટાઇન હેમરેજ. This is a case of the pride for the Surat's neurosurgeon. They have never seen before in pontine hemorrhage where brainstem has been affected, and it was a large clot, and it was diagnosed hypertensive stroke, pontine hemorrhage affect, and venti, no chance to survive. Today he is eating bhajia at home. Me and my doctor Mukund Sawakia, my friend, we have seen into the ICU. First day when I see what is happening, okay, तू रहने दे, इसमें कुछ मत कर, कुछ नहीं होगा. ये बहुत बड़ा हेमरेज है, decompressive surgery भी नहीं हो सकती, क्योंकि it is very difficult. Brainstem has been affected, midline has been shift, and large clot. बोला कि ओपीडिया है ना अपने पास, हेमरेज हुआ है. कहाँ हुआ? अंदर. तो क्या हुआ? स्ट्रोक हेमरेजिक, क्रोटोलस हॉरिडस दिया, 2 दिन में वो जागता हुआ बाहर आया, फिर से सो गया. My friend Dr. Pratik says Listen to sir. What sir says? This is the time to give Arnika. And we see the video of the sir approach to the coma, approach to the ICU patient in severe grave condition. When physiology is still working, give the arnica, then go for the GCS, whether it is magnesium or Ophidia or whatever. Then we prescribe for 1 month arnica 50 m 1 hourly. All the hemorrhage has been disappeared, and today he is eating bhajia by the grace of Bothrops, because first symptoms was developed when he was sitting in the office. He has lost the speech and affect the, then the hemorrhage occurred. What was the first symptoms was appear? It was the aphasia with hemiplegia. This is an indication of Bothrops. But each and every drug has time to prescribe. Where to prescribe and when to prescribe. What to prescribe we understand. And this is a beyond dare to be wise, and it is very easy for our homeopath. We will never say it is difficult, because we understand the process. Okay, why has been occurring, and science only believes what has been occurring. Okay. Toxic of his, I can say the Cedron snack. Clock-like periodicity and edema. But annual periodicity of neuralgia. Okay. Black mamba. I have prescribed 2 minutes. Fastest, speedy, and deadliest. Never give the second chance after biting. This is the black mamba. And Bungaris, I have prescribed, but I cannot tell more than poliomyelitis or poliocephalitis. When I will take the result of Bungaris, then I will explain more. Today, this is enough, I think. This is, thank you. Thank you so much. Santi, બરાબર છે, શાંતિથી રાજા આવડે એક્સપ્રેસ અમે ઓલો કોમ્પ્યુટર લઈને બેઠો બોલવું પડે કોન્શિયસલી બોલવું પડતું